After the patient has been discharged from the hospital, the biocontainment clinical team discards all disposable items and linen into the red biohazardous waste bin and cleans gross spills of blood and body fluids according to procedure. The biocontainment trained ESD workers are to wait 24 hours before entering and cleaning the room. The 2 trained ESD workers, dressed in full PPE, should be prepared to see more equipment in the room than normal due to the extreme nature of the virus. No equipment will have been removed prior to their entering and will need to be cleaned thoroughly as part of standard operating procedure for Ebola virus patients. Only 1 trained ESD worker in full PPE is to enter the room carrying an electrostatic device with disinfectant. The second trained ESD worker in full PPE is to stay in the doffing area and be prepared to enter the room only if the first worker requires assistance. The supervisor will be reading the instructions aloud step by step as indicated in the SOP manual. The second ESD worker should push the drum with their feet from the doffing zone into the patient room. ESD worker number 1 is to tie up the red biohazardous waste bag previously left in the room and wipe down the exterior of the bag using Oxivir wipes. Once sealed and wiped, they should place the first bag into a second biohazard waste bag. After sealing and wiping down the outer bag, it should be placed into the drum. Use the electrostatic device to spray everything down, including paper products. Both workers leave the room and doff PPE, waiting 1 hour before entering the room again with new PPE, wipes, mops, disinfectant, and empty biohazard bags. The first worker enters the room with a tub of Oxivir and wipes everything down. Paper products should be thrown out. The room is to be cleaned top to bottom. As the last step, the first worker should mop the floor with disinfectant before leaving. Used wipes and mop heads are to be placed in a biohazardous waste bag. Wipe down the mop handle with Oxivir wipes and leave it in the room. All equipment is to be left in the room. Seal and wipe the biohazardous waste bag and then place it into a second bag, taking care to also wipe down the outside of the second bag. You can place the biohazard waste bag in the drum only if it has been wiped, double-bagged, and wiped again. The second ESD worker should now enter the room with the UVC robot for further disinfection. After placing the UVC robot in the center of the room, all hospital personnel should leave. The machine will be turned on by the ESD worker before exiting. The ESD worker will have 15 seconds to leave the room before the UVC robot begins to disinfect the room. If necessary, the other ESD worker can turn off the machine from outside of the room. After exiting, both ESD workers should next wipe their gloves with Oxivir and change gloves and booties in the doffing zone with a trained observer. After the UVC robot completes its sterilization cycle, one ESD worker in fresh PPE, including clean booties and gloves, will then enter the room and clean the robot from top to bottom using Oxivir. For larger rooms that require multiple sterilization cycles, do not clean the robot until the room is completely sterilized. Once the robot has been sterilized, both ESD workers are free to exit the room. The drum should be removed from the room and disposed of according to current protocols. The site manager, BCU co-directors, infection prevention and control, and safety departments will meet to discuss if the room can be cleared for reopening.